for the therapeutic interventions, there is several things we can do. The first things, we can use antibiotics differently. This is what I said earlier, because antibiotics have an impact of microbiota. The second thing is that we can use some prebiotic, that is to say, we can use some kind of food that will increase the growth of beneficial bacteria. This is mainly some work performed by Professor Pavan-Reddy groups, where they use resistant potato starch that will increase butyrate-producing bacteria. So far, there is only a few patients that have been treated, around 10 patients. It seems that when you give this to the patient, when you start before the conditioning regimens up to day 100 after allogenic stem cell transplantations, it's increased the number of butyrate-producing bacteria within the gut, but there is very few patients, so we don't know if there is a clinical effect of this. However, this is promising. The last thing that is maybe the most promising with the most result, this is the use of probiotic, that is to say directly to the use of bacteria. So first we say maybe we can use some selected strain of bacteria, but so far we don't know what are the good bacteria. This is difficult to culture the bacteria to give them. So what we are doing, this is doing some fecal microbiota transplantation when you give some poops from donors. And there is at this EBMT two presentations from two different teams that use fecal microbiota transplantations. In one of them, it is from third-party donors with good result on patients with steroid-resistant acute graft-versus-host disease. The second abstract, this is an oral abstract I presented at the EBMT meeting, when we are not using some third-party donors, but we are using a product that is called March 13, that is a pool from several donors that allow us to have a very high diversity product and to be sure to give all the beneficial bacteria to the patients. We treated in the compassionate use program so far 11 patients. They received 3 enema 1 week apart, and we evaluate response at day 28 after the first enema. And this was all patients with very severe steroid-resistant graft-versus-host disease, and we have an overall response rate of 82%. So it's very promising, very encouraging, and we really need some more results on these very exciting topics of fecal microbiota transfer in the setting of GvHD on allogenic stem cell transplantation.